Good morning everyone. Today I would like to discuss you regarding chicken pox. So I guess in first class we have seen what is smallpox, and today we are going to discuss regarding chicken pox. So this is the second topic in our fourth unit of community health nursing. So I would like to say you what is the definition of chicken pox. So chicken pox is also called as varicella, and it is an acute highly infectious disease which is caused by varicella zoster virus. So it is caused by varicella zoster virus. So what happens when a chicken pox is affected to the patient? The patient is having fever and malaise, and is having a vesicular rash. You can see in the slide he is having a vesicular rash. So this is the definition of chicken pox, and this is how a chicken pox infected patient will look like. You can see the rash. This is nothing but vesicular rash, and the patient will have fever as well as malaise. And you can see in the picture clearly how the rash will form when a patient is affected with chicken pox. Coming to the next point. So epidemiological study. Coming to the next point, epidemiological study. So you can see here what is the age and what is the host and in what environment the disease is transmitted. As you can see here, the agent is varicella zoster virus. So mainly the agent of chicken pox is varicella zoster virus. And what is the host? The host is nothing but people under 15 are most at risk. You can see here people under 15 are most at risk. Coming to the epidemiology. In epidemiology, what we are having? Agent we are having host, and through which environment it is transforming. Coming to the agent, what is the agent which is causing chicken pox? It is nothing but varicella zoster virus. It is nothing but varicella zoster virus. And who is the host? Host is nothing but human being. We are the host for this chicken pox virus. People under 15 are most at risk. Anyone who hasn't had it is susceptible. So people who doesn't had this chicken pox until the age of 15 years are most susceptible. They are more prone to get this infection. And through which it is transmitted? What is the transmission of this chicken pox? Means it is transmitted from an infected person through coughs, sneezes, or from contact with the fluid from chicken pox blisters. Most commonly transmitted in the early winter or spring when temperatures are moderate. So this is the favorable condition for the transmission of chicken pox from one person to another person. So coming to the brief, what is happening? The agent is varicella zoster virus, and the host is human being. Especially the persons who are 15 years below. And the environment is it is an droplet infection. It is transmitted from one person to another person through coughs, sneezes, or whenever we go and touch a person, whenever the blisters fluid is coming and falling on us, there are more chances of getting chicken pox. So this is the epidemiological trait. Coming to the epidemiological determinant, I said now what is the agent factor? Agent factor is nothing but varicella zoster virus. It is also called as human herpes virus. You can call it as alpha herpes virus also. So which people are more prone to get? Means immunosuppressive therapy. The virus may react to resulting in zoster. The person who are having weak immune system, these people are more prone to get this chicken pox. So coming to the source of infection. So what is the source of infection? What is the source of infection? Means nothing but usually a case of chickenpox, means the person who is having chickenpox is the source of infection. Oropharyngeal secretions, so the secretions which are emitted by a chickenpox infected person. Lesions of skin and mucosa, so the persons who is infected with chickenpox are having lesions on the skin. So secretions from those skin and secretions from those mucosa can result in chickenpox. Rarely the source of infection may be the patient with herpes zoster. So there is another condition which is called as herpes zoster. If any people are having this herpes zoster, those people might transmit the disease as a chickenpox to the healthy person. This is the agent factor. This is the agent factor. You can see the virus there. You can see the virus there on the slide. So this is how a chickenpox virus will look like under the electron microscope. Under the electron microscope. Coming to the infectivity. So what is the infectivity period of a chickenpox infected person or varicella zoster virus? The period of communicability of patients with varicella is estimated to the range from 1 to 2 days before the appearance of rash. The period of communicability of patient with varicella is estimated to the range from 1 to 2 days before rash and 4 to 5 days thereafter and 4 to 5 days thereafter. So if a person is exposed to the chickenpox and the varicella zoster virus has entered into this, so it will take some time before the appearance of rash. You can call this period as primordial phase. I will discuss it in the coming slides. So if a person has this infection and this has entered into the person, what it will mature and it will develop in the healthy person's body, so that it can produce its signs and symptoms. So before the appearance of rash, it will do its incubation period. So if a person is in incubation state also, he is able to infect the other person, and once the rash has appeared, till 4 to 5 days he is able to infect the other person, means he is contagious. The virus tends to die out before the pustular stage. The patient ceases to be infectious once the lesions have crusted. The patient ceases to be infectious once the lesions have crusted. So there are stages in the chickenpox. I will discuss you in the later. So vesicular stage, I'll show you. Wait 1 second. So these are the stages: macule, papule, vesicles and crusted phase. The chickenpox infected patient can be contagious till the vesicle stage. He is infectious in macule stage, as well as he is infectious in papule stage, he is infectious in vesicle stage. But when the crust is formed, he is not contagious, means this crust cannot transmit the infection from one person to another person. So coming back to the point. Secondary attack rate. Chickenpox is highly communicable. The secondary attack rate in households contacts approaches 90%. So as I already said, chickenpox is highly communicable. So if a person in your family or in your society is infected with a chickenpox, if you are going around that person, if you are having communication, if you are having any contact with that person, there is high chance of getting chickenpox for us also. That is what the secondary attack rate in households contact approach 90%. Understood? So coming to the host factors, I already said the host factors. Chickenpox occurs primarily among children under 10 years of age. A few persons escape infection until adulthood. Immunity. So one attack gives us durable immunity. Second, attacks are rare. So I want to discuss this. So if you are infected with chickenpox during your childhood or during your lifetime, once you get this chickenpox, there are less chances of getting chickenpox again. What will happen means, if you are infected with chickenpox and if you are getting cured from it, our body will produce antibodies against this, whenever antibodies against the disease. So whenever this infection is coming and entering our body, our immune system will fight against it, so that we are not infected secondarily. So that's what, if a person gets chickenpox for the first time in life, there are rare chances of getting second attack of chicken pox. The accusation of maternal antibody protects the infant during first few months of life. No age, however, is exempt in the absence of immunity. Nothing but if we are getting some immunity from our mother, so whatever the antibodies that is acquired during birth from the mother will protect the baby for certain amount of age. But after this, if the baby immune system becomes weak, there are more chances of getting this varicella zosterum. The IgG antibodies persist for long time, and their presence is correlated with the protection against varicella. So I said earlier, whenever we are infected with chickenpox, whenever the chickenpox is infected us and we have cured from the disease, our body will start producing antibodies, nothing but IgG antibodies. What will happen? These IgG antibodies which are present in our body, they will fight against the varicella zosterum, so that there is less chance of getting secondary attack. So what will happen if we get the chickenpox during pregnancy? Infection during pregnancy presents a risk for the fetus and the neonate. So if you are getting infection during the pregnancy, there is more chances of mortality for the fetus as well as neonate. Coming to the environmental factors. So chickenpox shows a seasonal trend in India. So in India, chickenpox shows a seasonal trend. The disease occurring mostly during the first 6 months of the year, and overcrowding favors its transmission. So most of the time, January to April or May, it was like tropical season for us. It will be little dry. So these are some favorable conditions for the chickenpox to grow. So since it is a contagious disease and it is transmitted from one person to another person, through how? Whenever a person sneezes, whenever a person coughs, whenever a person comes in contact with the infected person, it will give rise to new case. So overcrowding. So whenever there are more number of people living together, if one person in the community gets the chickenpox, there are more chances of getting the infection to the other person. So transmission, how the chickenpox is being transmitted. So we have discussed it in the earlier slide. Again I am saying chickenpox is transmitted from person to person by droplet infection and by droplet nuclei. More patients are infected by face-to-face and personal contact. The portal of entry of the virus is respiratory tract. The virus can cross the placenta barrier and affect the fetus. Condition is known as congenital varicella. So if a person is getting infection during the pregnancy, if a person is getting infection during the pregnancy, there is a condition to the fetus, nothing but called as congenital varicella. So how the virus is entering our body? The virus is entering our body through respiratory system. Coming to the incubation period. So if you see the incubation period, in earlier classes also I have said incubation is period nothing but it is the amount of time that is taken by the organism which has entered into our body to mature, to develop and to show its signs and symptoms. So coming back to chickenpox, what is the usual incubation period? Is 14 to 16 days. Although extreme as wide as 7 to 21 days have been reported. So generally they will say 14 to 16 days, but 7 days are enough to show the initial symptoms. 7 to 21 days, it can be 7 days or it can be 21 days. So this is one picture of varicella zoster virus. So coming to the clinical features, what are the clinical features? The clinical spectrum of chickenpox may vary from a mild illness with only few scattered lesions to severe febrile illness with widespread rash. I will show you in the coming images. So, what they are saying, clinical spectrum of chickenpox may vary from mild illness with a few scattered lesions, means first there might be a mild fever to the patient and lesions are also very less. To a severe febrile illness, what will happen gradually, the patient may end up in higher temperature and there will be more number of lesions. So, it varies from mild illness to severe febrile illness with widespread rashes. So, we can say it as prodromal phase. Prodromal phase is nothing but initial stage. It is for the first 1 to 2 days. What is happening? The patient is having fever as well as malaise. And the second one is successive crops, 2 to 4 days of pruritic vesicles, successive crops of pruritic vesicles. What is happening? Whatever the vesicles are appearing, whatever the initial vesicle is appeared, it is going into successive crops. More number of lesions will start to appear. More number of lesions will start to appear. Generally appear first on head and most concentrated on trunk. So, what is happening? The first initially the rash is appearing on the head, forehead it is appearing, and gradually it is more concentrated on the trunk, can spread over entire body causing 250 to 500 itchy blisters. So, whenever a patient is infected with varicella zoster, you can observe from 250 to 500 itchy blisters on the patient body, generally mild in healthy children. If a healthy child is infected with the varicella zoster, you can see the rash distribution is very less. Chickenpox, the clinical course of chickenpox. So, what is the clinical course? It is mainly divided into two types. Pre-eruptive stage and eruptive stage. So, what is pre-eruptive stage? Onset is sudden with mild and moderate fever and pain in the back, shivering and malaise. So, what is happening in pre-eruptive stage? So, if a person is infected with the chickenpox, so initially these type of symptoms are appearing. What is appearing? Mild to moderate fever. There will be fever, it can be mild or it can be moderate, and pain in the back. Patient may have pain in the back, and shivering and malaise. Patient may be having shivering as well as body aches. This stage is very brief and lasting about 24 hours. So, this stage, pre-eruptive stage, is very brief, means it is very short and it is lasting only for 24 hours. In adults, the prodromal illness is usually more severe and may last for 2 to 3 days. So, if it is coming in children, this pre-eruptive stage, it is only for 24 hours. Whereas in the adult, this prodromal illness phase may be last for 2 to 3 days, and it is more severe compared to the child. Before the rash comes out. What is the eruptive stage? So, the name itself, pre-eruptive, before the appearance of rash, eruptive, after the appearance of rash. In children, the rash is often the first sign. So, if you see in adult, the first sign is they are having severe fever compared to the children, and it will last for 2 to 3 days before the onset of rash. But whereas in children, it is just 24 hours and the onset of rash will appear within 24 hours. It comes on the day the fever starts. So, you can see it here, the day itself, whenever the fever is appearing, within 24 hours we are able to see the blister. The rash distant features are. So, how the rash will look like? Distribution. The rash is symmetrical. It is symmetrical in shape. The first appears on the trunk where it is abundant, and then comes on the face, arms, legs where it is less abundant. So, the first rash will appear on the trunk, mainly on the abdominal and chest region. So, it is more abundant. More number of rashes are seen on the trunk. Whereas less number of blisters can be observed on the face, arms and legs. So, Mucosal surfaces and less abundant. Mucosal surfaces are like buccal and pharyngeal are generally involved. You can see the rashes on the mucosal surfaces also mainly on the buccal and pharyngeal, So this is the distribution of chickenpox rash. See, you can observe clearly. So the left side is smallpox and the right side is chickenpox. So how the chickenpox is? See, more number of rashes are seen on the trunk and face. Coming to the extremities, it is very less. More number of rashes can be seen on the chickenpox can be seen on the trunk and less on the surface of legs. See, you can see it in the compared to smallpox. It is centrifugally distributed. In smallpox. You can observe more number of rashes on the face, hands and extremities. Coming to the chickenpox, there are less number of vesicles on the hands and legs, but more number on the trunk and face. And the next part is face. So this is how the chickenpox distribution will look like. So rapid evolution. The rash advances quickly through the stages of macule, papule, vesicle and scab. In fact, the first to attract attention are often the vesicles filled with clear fluids looking like dew drops on the skin. Scabbing begins after 4 to 7 days after the rash appears. So initially when the rash appears, it will be like a small like dew drops. It will be so initially what is happening? In rapid evolution, quickly the stages will go on: macule, papule, vesicle and scab. So what is happening? The first thing that will attract means initially when the rash is appearing on the body, we can see the vesicles. They are just like dew drops. And scabbing begins after 4 to 7 days when the rash had appeared. See, I will show you the same spot over 15 days. So whenever during the first day, you can observe during the day 1, though there is initial appearance of rash, and you can see in the second picture it is looking like a dew drop. Similarly, it is day 2, day 3, day 4. You can see the course of action. So at the end of the day 5, day 15, a scab is being formed. At the end of day 15, the scab is being formed. So these are like, you can see this is the macule, this is a papule, and these are vesicles, and these are crusted macules. These are the lesion stages of chicken. So pliomorphism. What is pliomorphism? All stages of rash, that is papules, vesicles and crusts, may be seen simultaneously at one time in same area. Why this is happening means this is due to the rash appearing in successive crops from 4 to 5 days in the same area. I will show you the picture. So you can see, you can consider this area. So papule, it is the first stage, and blister, it is the second stage, and ulcer, it is the third stage. For example, I am saying, if you see here, this is the same area. In same area, you can observe a papule which is newly forming blister, which is newly forming rash, and blister which has already formed, and ulcer which has gone several stages, which has undergone several stages. Why this is happening is, this is mainly due to successive crops for 4 to 5 days in the same area. Mainly this is due to successive crops in the same area for the 4 to 5 days. So this is called as pliomorphism. The next one is complications. So chickenpox is mild and self-limiting disease. What is chickenpox? It is a mild and self-limiting disease. It is uncomplicated. It is in uncomplicated cases, mortality is less than 1%. In uncomplicated cases, the mortality is less than 1%. Severe complication occur in immunosuppressed patient and may occur in normal children and adults. So severe complications means where there is chances of getting death, it is very less, but if it is complicated, it is mostly occurring in the patients who are having weak immune system, and when it is occurring in children and adults, So another complications include hemorrhage, means so due to the blister, if there is any bleeding complications in an infected patient, it may raise in varicella hemorrhage, pneumonia, encephalitis, acute cerebellar ataxia, Rash syndrome, fetal death and birth defects in case of maternal varicella during pregnancy, and acute retinal necrosis and progressive outer retinal necrosis in case of AIDS patients. These are some complications, and most common complications are bacterial infection of the skin and soft tissues in children, septicemia, toxic shock syndrome, necrotizing fasciitis, osteomyelitis, bacterial pneumonia and septic arthritis. These are the most common complications of varicella zoster, and these are the most common complications of varicella zoster. So you can see the patients who are having this type of complications. So these are some pictures of complications of chicken pox. So what is the laboratory diagnosis for chicken pox? So you can see rarely required as clinical signs are clear cut. So you can see the person is infected with chicken pox whenever you see, you can see the distribution of the rashes. Where it is present, it is mostly present on trunk as well as on the face, and less in the legs as well as hands. So you can clearly observe, you can see the stages, you can see the signs and symptoms. At first day the patient may have fever, malaise, back pain, and gradually initially the rash will appear on the trunk or on the face. It is most abundant on the trunk and less abundant on the face, extremities and legs. So like that you can differentiate. Examination of vesicle fluid in electron microscope shows round particles. Use it for culturing virus. Serology is used for epidemiological survey. So these are the laboratory diagnosis. So how we can control the chicken pox? What is the control for chicken pox? The usual control measures are notification such as isolation of the cases for about 6 days. Isolation of the cases about 6 days. So whenever a person is infected with chicken pox, you have to isolate the person. And onset of rash and disinfection of articles soiled by the nose throat discharge. So whenever you find a patient with chicken pox, the first thing you have to do, the control measure, is isolating the person and isolating everything. The articles which are used to the person must be sterilized before or disinfected before the next use, and the cloths which are soiled and the environment which is soiled must be disinfected. If not, there are more chances of transmitting the infection to another person. See, this is the isolation. And the another one for controlling varicella zoster virus is varicella zoster immunoglobulin. Varicella zoster immunoglobulin. So it is given within 72 hours of exposure, particularly in immune suppressed person, which includes, so these are given mainly in the person who are having weak immune system. So these such as susceptible person receiving immunosuppressive therapy and congenital cellular immunodeficiency, the patient who are having congenital immunocellular deficiency, and acquired immunodeficiency patient, pregnant women, newborns, premature infant with low birth weight. So these people are getting this varicella zoster immunoglobulin. Varicella zoster immunoglobulin. It has no therapeutic effect. This one doesn't have any kind of therapeutic effect. The dose of the varicella zoster immunoglobulin is 12.5 unit per kg body weight. 12.5 unit per kg body weight. So once you take the dose of the varicella zoster immunoglobulin, again after 3 weeks you will get the second dose. Again at 3 weeks you will get the second dose, not given along with the varicella zoster. This doesn't have any connection with the vaccine. The vaccine is entirely different and this medicine is entirely different. Varicella zoster immunoglobulin, it is given to the persons who are infected with the chicken pox within 72 hours, mainly to the persons who has less immune system. Coming to the vaccine, so live attenuated varicella vaccine is used. What kind of vaccine is used means live attenuated varicella vaccine. It is recommended for the children between 12 to 18 months. So it is given at the age of 12 to 18 months. Mainly the persons who did not get any kind of chicken pox during this period of age. 90% efficiency is suggested. So the persons who got this vaccine are having 90% efficiency to fight against the chickenpox disease. Should not be given to immunocompromised persons. So this vaccine doesn't this should not be given to the persons who are immunocompromised, nothing but HIV positive persons or pregnant women. Thank you.